when it comes to technical teaching. So that was not effective. ನಾನು ಎಷ್ಟೇ ಟ್ರೈ ಮಾಡಿದ್ರು ಅವಾಗೆಲ್ಲ ಗೂಗಲ್ ಬಂದಿತ್ತು. ಐ ವಾಸ್ ಓಪನ್ ಟು ಸೋ ಮೆನಿ ಟಾಪಿಕ್ಸ್ ಅಂಡ್ ಸೋ ಮೆನಿ ವಿಡಿಯೋಸ್ ಅಂಡ್ ಆಲ್, and I thought of putting it across in the classes, but that was not able to. I mean, I was not able to. I could say, but that was not effective. But since you are not able to bring in that energy in saying, because I was in the control of, I mean, what you should say, the continuous pain, which was not very good in feeling in my voice. So adu nanna challenge. So that time I joined the system, thanks to Manasa and Narayan and the whole of the community who are there today also. And I could lose my weight and come out of my knee pain. And earlier I never used to work out because I know I may cause injury to my joints. But later on, when knee pain reduced, my energy was picking up, I started working out. And now I don't want to miss at any cost the workout, but I keep doing it, and I do it more rigorously now. So once what was something like a warm-up, it's not a warm-up at all now. Now I can do full course of all types of workout, strength training or anything. So thanks to my coaches, thanks to my community, thanks to my products, and thanks to the, what you say, the concentration that my coaches bring in, the focus, determination my coaches bring in. And I am here to present you that particular thing. And of course, it's my learning. Anybody can add their experience at any point of time. I don't mind. Okay. And also, this is something that will help you to know how to deal with your pain and how to use the products effectively and come out of whatever the problem that you are having with respect to joint pains and that bone related issues. Okay. And anybody can add, as I said. Everyone who has gone through like me, I think yaridare ivattu. Okay, Sabiha is there with me, and Madhavi is, she has the same complaint. Lalita madam illa, ಅವರು ನನ್ನ ಜೊತೆಗೆ, we have gone through the same levels of transformation actually. So I think adre our age innu salpa jaasti, the recovery was slow, so it's okay. What I want to tell you is that when we come to the, as we age, we have what you say, the degeneration, but it's going to be progressive. And the degeneration is going to be progressive because in the mid-age, or when we start earning in our life, committed to a job, committed to a business or something to a passion and all, we try to do more of it. Okay. And then we try to make our living comfortable, and in the run we forget what our body is missing, and we don't nurture it because ನಮ್ಮ ಯಂಗ್ ಏಜ್ ಅಲ್ಲಿ ಆಗ್ಲಿ, ನಾವು ಚೈಲ್ಡ್ಹುಡ್ ಆಗ್ಲಿ, ನಮ್ಮ ಅಪ್ಪ ಅಮ್ಮ ಇರ್ತಾ ಇದ್ರು ಅಥವಾ ನಮ್ಮ ಫ್ರೆಂಡ್ಸ್ ಇರ್ತಿದ್ರು, ಜೊತೆಗೇನೋ ಒಟ್ಟಿಗೆ ತಿಂತಾ ಇದ್ವಿ, extra tinta idvi. And my parents are they used to feed us healthy homemade food, and all vegetables we used to eat and all. Somehow the nourishment was complete. I cannot say 100%, but it's okay, we could manage, and our energy levels were high, and with that energy we continued in our professions, and there in the run we forgot how to nurture our body. And because we need to prepare and we need to eat, especially ladies. Okay. And even when in families where both the people, I mean, parents are earning, I mean to say husband and wife both are earning, then it is something, whatever is the quick stitch antivala athara, whatever you can prepare in half an hour, 1 hour, that is what is going to be there on the plate. And I don't know whether it is complete by nutrition or complete by satisfaction. Neither of it I know for sure. Yakandre nane aa tharadavಳು working woman, so I never used to put the complete meal that what I eat now. Okay. So idella irli. So what I was trying to tell you is, one is because of job stress or anything other than bringing up the children, that stress. Okay. So over the period, the stress has given rise to hormonal changes. And another thing is that we forgot to nourish our body, and we are in hyperactive state. Andre, we keep our activity more and more. ಯಾಕೆಂದ್ರೆ ಬೆಳಗ್ಗೆ ಎದ್ದು ಹೋಗೋದ್ರಿಂದ ಹಿಡಿದು ರಾತ್ರಿ ಮಲ್ಕೊಳ್ಳೋವರೆಗೂ we are doing something or the other. And in this case, we all have forgotten what our body needs, and that is when body shows the symptoms of what you say, the stress that we are going through and the strain that it is feeling. What we are now, we are torturing our body. Okay, so that is going to show up. Okay, so the first thing is that you don't feel like getting up when you are sitting in the sofa at the end of the day. Okay, and at any point of the time you feel your body heavy to do whatever you want to do. That is one thing. And another thing, you feel the stiffness in your joints when you stand up, when you make your back straight. Okay, so these are the symptoms that your bone is actually losing its calcium levels, and it is something not able to cope up with the activities what you are going to do. ಸೊ ಎಲ್ಲ ಜಾಯಿಂಟ್ಸ್ ಅಷ್ಟೇ ಒಂದ್ರ ಮೇಲೂ ಒಂದು ಹೀಗೆ ಕೂತಿರತ್ತೆ. ನೀವ್ ಯಾವ್ದನ್ನಾರ ತಗೊಳ್ಳಿ, ಈ ಬೆರಳಲ್ಲಿ ಇರೋದು ಇದನ್ನ ತಗೊಳ್ಳಿ, ಈ ಶೋಲ್ಡರ್ ಜಾಯಿಂಟ್ಸ್ ತಗೊಳ್ಳಿ, ಈ ಇದನ್ನ ತಗೊಳ್ಳಿ, ವಾಟ್ ಯು ಕಾಲ್, ಮರ್ತೋಯ್ತು ರವಿನಾರಾಯಣ, ಎಲ್ಬೋ ತಗೊಳ್ಳಿ, ಹಿಪ್ ತಗೊಳ್ಳಿ, ಹಿಪ್ ಜಾಯಿಂಟ್, ಹಿಪ್ ಅಂಡ್ ಥೈಸ್ ಎಲ್ಲಿ ಜಾಯಿನ್ ಆಗತ್ತೆ ಅಲ್ಲೆಲ್ಲಾನು, even to make your movement free and to be able, this is coming from our nature, body structure ಹಾಗೆ. ಇದು ಯಾವುದನ್ನು ಒಂದಕ್ಕೊಂದು ಜಾಯಿಂಟ್ ಆಗಿರೋದಿಲ್ಲ. The joint is not with the bone, but it is with the collagen. Okay, there is a soft tissue between the bones. ಈಗ either the collagen levels drop down, or the bones are going to be, say, they have gradually decreased in its, changed their shape because of wear and tear. So it so happens that the gap between them is going to reduce. Any joint you take, the more often you do. ಈಗ ದಿನಕ್ಕೆ 100 ಚಪಾತಿ ಮನೆಯಲ್ಲಿ ಮಾಡಬೇಕು ಅಂತಂದ್ರೆ naturally the shoulders are in this stress. You are overdoing that. Okay, and if you are, say, doing something with the hands, that putting everything across, the cutting agli adagli yaudadru frequent ag ಮಾಡ್ತಾ ಇದ್ದೀರಾ ಅಂದ್ರೆ ಈ ಜಾಯಿಂಟ್ ಅಥವಾ ಫಿಂಗರ್ ಜಾಯಿಂಟ್ ಯಾವ್ದಾದ್ರು ಅಷ್ಟೇನೆ ಅದು ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಅಂಡ್ ಈಗ ಕೆಲವು some jobs, if you come to, say, policemen, teacher, they keep standing for hours together. And that is when the stress is on the knees and the ankles and all. So that is, and also backbone. Adunu ashtenene. Adantu, you can say the wonder that nature has done. Adu ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಒಂದು ಜಾಯಿಂಟ್ ಅನ್ನ ಮೇಲೆ 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 ಇಟ್ಟು ಅದೊಂಥರ ದಾರದಲ್ಲಿ ಮಣಿ ಪೋಣಿಸ್ದ ಹಾಗೆ. ಅದು ಎಷ್ಟು ಚೆನ್ನಾಗಿದೆ ಸ್ಟ್ರಕ್ಚರ್ ಅಂದ್ರೆ, you never feel the pain when you are moving this way, that way and all. That is, of course, when you are healthy. But idella ನಾವು ನೋಡಿದಾಗ what we are doing is that when we keep doing lot of things over and over and for longer duration, we are actually causing the injury to that particular joint. Okay, so this is something everybody has to understand. Overdoing, and ಈಗೇನಾಗತ್ತೆ ಅಂದ್ರೆ ಬೆಂಡ್ ಮಾಡ್ಬೇಕಾದ್ರೆ, see, there is a way of moving our hands. ಹೇಗ್ ಮಾಡ್ತೀವೋ ಹೀಗೆ ಮಾಡ್ಬೇಕು. ಇದನ್ನ ಹೀಗ್ ಮಾಡಕ್ ಹೋಗಿ ಇದನ್ನೇ ಫ್ರೀಕ್ವೆಂಟ್ ಆಗಿ ಮಾಡಿದ್ರೆ, ಅಫ್ಕೋರ್ಸ್ ಮಾಡಿ, ಬಟ್ ಇದನ್ನ ಜಾಸ್ತಿ ಮಾಡಿದ್ರೆ you are causing some different kind of movement where the muscle is not able to cope up. Muscle around the joint, it's not able to cope up. ಈಗ ನಿಂತ್ಕೊಳ್ಳೋದು ಅಷ್ಟೇನೇನೆ, ಎಷ್ಟು ನಿಮ್ಮ ಟೆಂಡನ್ಸ್ ಸ್ಟ್ರೆಚ್ ಮಾಡಿ ನಿಂತ್ಕೊಳಕ್ ಆಗುತ್ತೋ ಅಷ್ಟು ಅದಕ್ಕೆ ಪ್ರೆಷರ್ ಕೊಡ್ಬಹುದು. ಯು ಕ್ಯಾನ್ ಆಸ್ಕ್ ಇಟ್ ಟು ಡೂ ಇಟ್ ಫಾರ್ ಯು. But if you keep overdoing it, then that is also going to feel the strain and it's going to show up. That what I said, the pain. The first instance is the stiff. The next thing that comes is the pain. And of course, ಆಮೇಲೆ ನಿಮ್ಮ ಜಾಯಿಂಟ್ಗಳಲ್ಲಿ ರಿಸ್ಟ್ರಿಕ್ಟೆಡ್ ಮೂವ್ಮೆಂಟ್ ಶುರು ಆಗತ್ತೆ. The bend that you want to do, say for example, ಕಾಲನ್ನೇ ಪೂರ ಹಿಂದಕ್ಕೆ ತಗೊಂಡು ಕುತ್ಕೊಳ್ಳೋದಾಗ್ಲಿ ಆಗೋದಿಲ್ಲ. The Padmasana, that is not at all possible. Those who are feeling the joint pain in the knees and ankles. ನನ್ನ ಕೈಲಿ ಇವತ್ತಿಗೂ ಆಗ್ತಾ ಇಲ್ಲ. I cannot sit ಕಂಪ್ಲೀಟ್ಲಿ. ಆದ್ರೆ ಆ ಪೋಸ್ಚರ್ ಏನ್ ಅದನ್ನ ಪಿಕ್ಚರ್ ಪರ್ಫೆಕ್ಟ್ ಆಗಿ ಕುತ್ಕೊಳ್ತೀವೋ ಅದಾಗೋದಿಲ್ಲ. ನಂಗೆ ಕಾಲ್ ಸ್ವಲ್ಪ ಸ್ಪ್ರೆಡ್ ಆಗತ್ತೆ, ಇಲ್ದಿದ್ರೆ ಸ್ವಲ್ಪ ಹೊತ್ತು ಮ್ಯಾನೇಜ್ ಮಾಡ್ತೀನಿ. ಬಟ್ ಇಟ್ ಈಸ್ ಸಮಥಿಂಗ್ ಲೈಕ್ I am causing some injury which I have recovered and I am causing the same injury once again. It will take another 1 month or say 15 days to recover from that pain. It is andre overdoing. So I will never do it. This is something that everybody should notice. ಈಗ ಬೆರಳು ಇಷ್ಟು ನನಗೆ ಈಗ ಮಡ್ಚಕ್ ಆಗ್ತಾ ಇದೆ ಅಂದ್ರೆ, if you have the problem of joints, okay, you may be able to bend it only this restricted movement. You cannot do it fully with all the angles that you are doing. Okay, it happens in every joint. Hip agli, knee joint agli, ankle agli, elladru agli. This is the third stage. Restricted movement adaga, then what you will do is you stop doing it, because overdoing it will cause the pain and you can't bear the pain. Bone pain is the severe pain that everybody should realize. It's not like on muscling, gaya adre ನೋವು ಆದ್ರೆ ಅಥವಾ ಹೊಟ್ಟೆನಲ್ಲಿ ಏನೋ ಅಪ್ಸೆಟ್ ಆದ್ರೆ ಆ ತರ ನೋವು ಅಲ್ಲ ಅದು. ಬೋನ್ ಪೇನ್ ಈಸ್ ದ ಮೋಸ್ಟ್ ಸಿವಿಯರ್ ಪೇನ್ ದಟ್ a body can experience, and apart from delivery pain. Okay, so that's a different thing. So if that pain is going to be continuous, then what you will do, you keep resting. You eat because you are hungry. You are stressed up and those things are not properly digested, whatever you consume. There are other things happening in the body. But since you are keeping at yourself in the one place and not active for the day, then you start putting on weight. And putting on weight will put more stress on the joints. So this is something, over the period, this becomes progressive. And that is when the worst things are going to happen. Idi eshtu janakke idanna, all of you might have experienced this. How many of you? Almost whoever has gone through the issues of the joint pain have gone through. So slight pain, then restricted movement, then not feeling active, and then putting on the weight, and then the worst thing is going to happen. So the remedies are there. Okay, so we'll come to that. But there is another thing which I was experiencing. The bone, it's actually experiencing the wear and tear, and it is losing its concentration, calcium concentration. And idenagatte antandre ಒಂದು ಸ್ಮೂತ್ ಸರ್ಫೇಸ್ ಅದು ರಫ್ ಆದ್ರೆ, ಈಗ ಮೊಸೈಕ್ ಫ್ಲೋರಿಗೂನು ಹೊರಗಡೆ ಟಾರ್ ರೋಡಿಗೂ ಡಿಫರೆನ್ಸ್ ಗೊತ್ತಲ್ಲ, ಆ ತರ ಇಟ್ಸ್ ಗೋಯಿಂಗ್ ಟು ಬಿ ವೆರಿ ರಫ್ ಆನ್ ದ ಸರ್ಫೇಸ್. ಸೊ ದಟ್ ಈಸ್ ವೆನ್ the muscles are also going to itch and kind of one rough feeling irodrinda, that pain is going to be more severe at that time. So idu aglik bidbard. The bone edges should be very smooth. That is one thing, wherever they are there in the joints or something. Okay, and what I was trying to tell you is that we start losing hormone when hormone levels are affected. Notice that the deposition of the calcium is also not happening at a regular interval. And that means what we lose, we should actually recoup. Okay, that is not going to happen. And for ladies, there are few instances that is going to happen. One is childbirth, and the other one is going to be during menopause. Neevu yavadara period togoli, pre-menopause, post-menopause, or during menopause. Our hormone levels are going to be what? They are not as regular as in a normal woman. Okay. So avaga, then again, there are some catalytic activities that happen. like loss of vitamin D, and which actually helps in putting up in the calcium in our bones. Those things will happen. So this is something that is the arthritis, if we have developed around 35 and 40, and if it is in the infancy, the problem will worsen for ladies during menopause. So this is something I noticed for myself, because my thyroid levels were not normal, and I was taking tablets, and it was hitting my bone levels as well. Okay, bone pain adella tumba jaasti aagta hai. So these are something, as I said, catalytic, and our intake of these catalysts are going to be limited, and we forget that in our daily activities. We know we have started, we have learned it in our school and everything, but we forget because we are so busy in our own routine and working and other things. So this is the second point that I want to tell. And there is one more thing which everybody should notice. If we don't use a particular joint for a period, it becomes by itself stiff. ಯಾರಾದ್ರೂ ನೋಟಿಸ್ ಮಾಡಿ, ನೀವು 3 ಅವರ್ ಪಿಕ್ಚರ್ ನೋಡಿ, ಎದ್ ನಿಂತ್ಕೋಬೇಕಾದ್ರೆ ಕಾಲು ಬೆನ್ನು ಒಂದ್ಸರಿ it will show the fatigue. Okay, so that is something that everybody might have noticed, but ade condition progressive adre we get our joint pain. That is the thing. So then let me come to the arthritis. This is where the technical things will come into picture. These are our experiences, this is where the cause is, and this is how it can worsen. Now let us look at what are the different types of arthritis. Non-literature, there are 5 different types. Okay, one is osteoarthritis, which everyone will experience, okay, in a severe form or a minute level or first level or second level, that may happen. And there is a rheumatoid arthritis, then psoriatic arthritis, then there is juvenile arthritis, then there is gout. Osteoarthritis is something that we can manage. Okay, so we have to supply back that calcium, rebuild the calcium levels, restructure the bones, build up the collagen, and try to move more so that you are not overweight, reduce your weight, and all that. If we do, osteoarthritis is manageable. ರುಮೆಟಾಯ್ಡ್ ಅರ್ಥರೈಟಿಸ್ ನಲ್ಲಿ ಇದೇನಾಗತ್ತೆ ಅಂದ್ರೆ ಜಾಯಿಂಟ್ ಹೀಗೆ ಆಗೋ ಬದ್ಲಿ, ಇದು ನನಗೆ ನಾರಾಯಣ್ ಅವರೇ ತೋರ್ಸ್ಕೊಟ್ಟಿದ್ ನನ್ ಜಾಯಿಂಟ್ ಬಗ್ಗೆ, ಹಿಂಗಿದ್ದಾಗ ಹಿಂಗಾಗತ್ತೆ. ಇದು ರುಮಟಾಯ್ಡ್ ಅರ್ಥರೈಟಿಸ್ ನಲ್ಲಿ ಈ ಸುತ್ತ ಇರೋ ಮಸಲ್ಸ್, ಕೊಲಾಜಿನ್, ಇದನ್ನ ಆ ಇನ್ಫೆಕ್ಟೆಡ್ ಸೆಲ್ ಇಟ್ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ಈಟಿಂಗ್ ಇಟ್. ಇಟ್ ಈಸ್ ಅ ಡಿಫರೆಂಟ್ ಕಂಡೀಷನ್ ವೇರ್ infection, inflammation grows around the joints. The joint will sit exactly like this. There is no movement like this. Ee thara agate rheumatoid arthritis. The whole tissue part is eaten up and inflammation is around that joint. So idu knee nalli nimge chennagi gottagate. Yaude inflammation, the fluid levels will build up, and that is going to cause the what you say, the swelling. ನಿಮಗೆ ಬೋನ್ ಪೇನ್ ಜಾಸ್ತಿ ಆದಾಗ ಈ ಸ್ವೆಲ್ಲಿಂಗ್ ಜಾಸ್ತಿ ಆಗತ್ತೆ. ಆ ಡಾಕ್ಟರ್ ಹೇಳ್ತಾರೆ ಅದು ಆರ್ಡಿನರಿ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಲ್ಲಿ, ಇದು ನೀರ್ ತುಂಬಿಕೊಂಡಿದೆ, ಫಸ್ಟ್ ನೀರ್ ತೆಗಿಬೇಕು ಅಂತ. ಸೊ ಇದನ್ನ ಅವರು ಇಂಜೆಕ್ಷನ್ ಹಾಕಿ ತೆಗಿತಾರೆ. I haven't gone through those process. I really don't know, but I was told by doctor, if your inflammation doesn't come down, I have to suck it out with the injection and something, maybe with slight, what you say, I don't know, it should have been done in a surgery room or something. I don't know. Anesthetic, local anesthetic kottu ಮಾಡ್ತಾರೋ,
steroid injection madam.
That they may give. That's the next level of, if you go to the doctor, that's the next thing that they will tell. Of course, in the first place, they will suggest bring down the weight, and they suggest calcium intake, everything they will do, and also stress kadme ಮಾಡ್ಕೊಳ್ಳಿ ಅಂತನೂ ಹೇಳ್ತಾರೆ. we try to ignore somehow. ಮಾತ್ರೆ ತಗೋತಿದ್ದೀನಲ್ಲ ಸರಿ ಹೋಗ್ಬೇಕದು ಅಂತ. So we will never do that. And then comes the stage of inflammation. When it is not coming down, then you get more and more restricted. Rheumatoid arthritis ನಲ್ಲಿ ಇಲ್ಲ ಕಾಲ್ನಲ್ಲಿ ವೇನ್ಸ್, ಇದು ನಿಮ್ಗೆ ಆ ಜಾಯಿಂಟ್ ಆ ತರ ಒಂದಕ್ಕೊಂದು ಕೂತ್ ಮೇಲೆ the blood vessels around that or in that particular portion, they also are restricted in their flow, and that is when rheumatoid arthritis will lead to the varicose veins and other things also. Most of the arthritis knee joint pain iroru varicose veins and ಒಂದಲ್ಲ one point ಅಲ್ಲಿ experience ಮಾಡ್ತಾರೆ. But if they correct it early, then that is good. They may not go to that severity level. ಇದಾದ್ಮೇಲೆ ಸೋರಿಯಾಟಿಕ್ ಅರ್ಥ್ರೈಟಿಸ್ ಅಂತ ಹೇಳ್ತೀನಿ. ದೇರ್ ಇಸ್ ಅ ಸೋರಿಯಾಸಿಸ್, ಸ್ಕಿನ್ ಸೋರಿಯಾಸಿಸ್ ಕಂಡೀಷನ್ ಇದೆ. ಇಫ್ ದಟ್ ಕಂಟಿನ್ಯೂಸ್, this shows up only in the finger tips. ಇದು ಬೇರೆ ತರ ಬೆಂಡ್ ಆಗತ್ತೆ, ಒಂಥರ ಬೇರೆ ತರ ಬೆಂಡ್ ಆಗತ್ತೆ. ಹೀಗಿದೆಯಲ್ಲ ನಂದು ಈ ಮೇಲ್ಗಡೆ ಬೆರಳು, ಆ ಜಾಯಿಂಟ್ ಹಿಂಗ್ ಬರುತ್ತೆ. ಸೊ ಅದು ನೇಲ್ ಕಲರು ಅದು ಎಲ್ಲ ಚೇಂಜ್ ಆಗತ್ತೆ. So this is also sometimes, once it comes to that level, it is irreversible. But you need to treat your psoriasis in the first case, okay? And then I said gout. This is when your uric acid is more concentrated, andre minerals, salts, adralli jaasti agade. We have a remedy in our system. We drink more water and we try to dissolve those salts and minerals and let it go in our urine. And we don't build up those salt and minerals levels in our urine. So idu salts and minerals levels concentration jaasti adaga, the uric acid will cause the joints, especially in the foot, ಈ ಫ್ರಂಟ್ ಆಂಕಲ್ ಒಂದು ದೊಡ್ಡದು ಇದೆಯಲ್ಲ ಬೆರಳು, ಹೆಬ್ಬೆರಳು ಅಂತೀವಲ್ಲ, ಆ ಆಂಕಲ್ಸ್ ನಲ್ಲಿ ಯು ವಿಲ್ ಸ್ಟಾರ್ಟ್ ಫೀಲಿಂಗ್ ದ ಜಾಯಿಂಟ್ ಪೇನ್, ಅಂಡ್ ಅದು ಕಾಲು ಎತ್ತಿ ಹೀಗಿಡೋದಕ್ಕಾಗೋದಿಲ್ಲ. It is experienced only in the foot part, the gout. Okay. Then there is juvenile arthritis. This may be something due to, and it happens only in kids, not the grown-ups. Rheumatoid arthritis, psoriatic arthritis, gout can happen in adults as well as children. But juvenile arthritis is a condition that is going to be there only with the kids, not with elders. And there are so many other things. Nimma spondylitic concern, that is a different arthritis. And then the the rib, that if you are having damages there and their wear and tear is there, that's a different type of arthritis. But all of them will start with the same symptoms, stiffness and a slight pain. And slowly, if that is going to increase, if you continue the same lifestyle, taking the pills for the pain, and that is going to cause some other issues in your body. Like I said, uric acid, ಆ ಥರದ ಪ್ರಾಬ್ಲಮ್ಗಳೆಲ್ಲ ಜಾಸ್ತಿ ಆದಂಗೆ the arthritis is going to worsen. And the peak is going to be somewhere between 40 to 50. At the age of 40 to 50. And if we don't treat it, it's something doctors suggest ಮಾಡೋದು 2-3 ವರ್ಕೌಟ್ ಮಾಡಿ, ಬಾಡಿ ವೆಯ್ಟ್ ಕಡಿಮೆ ಮಾಡಿ, ಆಕ್ಟಿವ್ ಆಗಿರಿ ಎಲ್ಲಾನು ಹೇಳಿರ್ತಾರೆ along with the supplements. But if we don't do it, then the problem is going to worsen. And that is when they suggest surgery and other things. Okay, so that is something we get restricted to the bed if we don't go for surgery. So ultimate is that I was in that stage. He told me very clearly, my specialist, he said, madam, you increase your ಇನ್ಶೂರೆನ್ಸ್ ಅಮೌಂಟ್ ಅಂಡ್ ದೆನ್ ನೆಕ್ಸ್ಟ್ ಇಯರ್ ನೀ ಜಾಯಿಂಟ್ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಮಾಡೋಣ. ಅದು ಹಾಗೆ ಇತ್ತದು, ಕ್ಲೀನ್ ಆಗಿ ವಿಸಿಬಲ್ ಆಗಿ ಎಕ್ಸ್ರೇ ನಲ್ಲಿ ಕಾಣಿಸ್ತಾ ಇತ್ತು. I also realized it was always like ಒಂಥರ ಟಿಕ್ಕಿಂಗ್ ನಂದು, ಅದು ಟಿಕ್ಕಿಂಗ್ ಬಾಂಬೆ ನನ್ನ ತಲೆನಲ್ಲಿ. So then I realized I must do something, and I did, and I'm so relieved. And also I must ask excuse of my coaches why I don't join workout every day. See, the thing is, the strength exercise and other things will not help my knee pain. I have to do low impact, more of it. So if I do, andre nanna kaal joint allene nan problem irodrinda, if I do more of exercise to my joint, then only I can get relieved by this. And if I do it, I will be comfortable for the whole day. Of course, with all the nutrition and food and activities and weight in limited levels, ತುಂಬಾ ಜಾಸ್ತಿ ಹೆಚ್ಚು ಕಡಿಮೆ ಮಾಡ್ಕೊಳ್ಳಿಲ್ದ್ರೆ I will feel very comfortable. And that is the state I am now. And I am enjoying my movement. And I dance. Earlier, dance ಮಾಡ್ತಿದ್ರೆ ಸುಮ್ಮನೆ ಹಿಂಗ್ ನೋಡ್ತಾ ಇದ್ದೆ. ನಿಜವಾಗ್ಲೂ ಫಸ್ಟ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಡೇ ನಲ್ಲಿ ಅವ್ರು ಕುಣಿಯೋದನ್ನ ನೋಡಿ ಸುಮ್ಮನೆ ಹಿಂಗ್ ನೋಡ್ತಾ ಇದ್ದೆ. The thing is, I had a doubt whether I will be able to do or not. If it can do, adu ಒಂಥರ, it was raising a lot of questions in my body. And if I do more of exercise without taking care of my joints, or if I dance more, if I don't care of my joint, then I would have caused some permanent injury to my joints. So that is when I was restricting myself. ಈಗ ಏನು ಇಲ್ಲ, ಆರಾಮಾಗಿದೆ. I lost my weight. I lost my knee joint ಅಲ್ಲಿ, ಇಲ್ಲಿ ಥೈಸ್ ನಲ್ಲಿ ಮತ್ತೆ ಸೊಂಟದಲ್ಲಿ ಇದ್ದಿದ್ದು ಅದೆಲ್ಲ ಒಂಥರ ಕ್ಲಟರ್ ತರ ಎಲ್ಲ ಆಚೆ ತೆಗ್ದು ಹಾಕಿದೀನಿ.
Prabha ma'am, till date I did not know so much in depth that you had undergone so much of issues and you had come to a conclusion that tick tick bomb statement you said now that I could really correlate.
ರಿಯಲಿ ನೀವು ಹೇಳ್ತಿದ್ದು ಅಷ್ಟೇ. ನೀವು ಆಪರೇಷನ್ ಮಾಡಿಸ್ಕೊಳಕ್ಕೆ ಹೋಗಿ ಯು ಆರ್ ಲುಕಿಂಗ್ ಫಾರ್ ಸೊಲ್ಯೂಷನ್. ಐ ವಾಸ್ ಆಲ್ಮೋಸ್ಟ್ ಇನ್ ದ ಸೇಮ್ ಸಿಚುವೇಶನ್. ನಿಮ್ಗೆ ಡಾಕ್ಟರ್ ಹೇಳಿದ್ಮೇಲೆ ಮುಂದಿನ ವರ್ಷ ನಿಮ್ಗೆ ಈ ತರ ಇದ್ರೆ ಇದು ಕಂಡೀಷನ್ ಇನ್ನೂ ವರ್ಸ್ ಆಗತ್ತೆ, ನೀ ಜಾಯಿಂಟ್ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಈಸ್ ದ ಓನ್ಲಿ ಸೊಲ್ಯೂಷನ್ ಅಂದಾಗ ಅದು ಟಿಕ್ ಟಿಕ್ ಬಾಂಬೆ ತಾನೆ.
You become
hopeless. That is when everyone has one or the other kind of tick tick bomb, Narayan. You agree with me?
I totally agree with you. That is why I go and meet people. Sometimes they don't open up, sometimes people open up. They don't open up because they feel that how can this person can give me a solution when biggest of biggest hospitals could not give me the solution. So but it's our duty to bring them here and show them results like yours, wherein they feel that, oh my god, if Prabhavathi could come out such kind of intense pain, then why can't I?
Yes. And let me tell you, there are 2-3 things that happened in my this thing. One is I was reducing my weight and I was reducing the stress on my joints. That was one thing. And because of all the nutrition, my inflammation was coming under control. That is second thing. And another thing with the calcium supplement and the calcium in our shake, Formula 1 ಅಲ್ಲಿ ಇರೋದಾಗ್ಲಿ ಇದ್ರಲ್ಲಾಗ್ಲಿ, they are this is the difference between the supplements that we take in Herbalife and the pharmaceutical supplements. The thing is that this actually is in the natural process of absorption. The supplements are so formulated that they get absorbed in our body very easily. You will never know that it is happening. But the thing is, in the pharmaceutical thing, our binding agent agli, our the chemical structure agli, it is not compatible for absorption in our body. Maybe 50% agbodu, but the thing is that here it is going to be 75 to 80%. Absorption will be there. And that is where the difference happens with our supplements in Herbalife and supplements from the pharmaceutical. Allu ನೀವು multivitamin ತಗೋತೀರಾ, illu ತಗೋತೀರಾ, but here you can see the results immediate, if not immediate, in the course of time, within 15 days, maximum 1 month ಅಲ್ಲಿ you will see the result. And that is the difference. And we are advised for activity levels to increase slowly, gradually, and then we will come to know the difference. And then we will have our water intake always normal or little more when it is summer and all. And that is how we try to get rid of our problems. And for me,